Well, this is truly a remarkable day with our groundbreaking of our new Heart and Vascular Tower and our new Level 1 Trauma Center. We've been working on this project for quite some time, and this partnership we've created with LSU really will help us to make sure we have the right environment for future physicians that will really work across the state. So this is a big part of our development of medical education. A little bit over a year ago, we entered into a cooperative endeavor agreement between Our Lady of the Lake and LSU. And really the essence of it is to move the residency training programs, which are currently housed at Earl K. Long, over to our campus here at Our Lady of the Lake. So future physicians will be trained now within our facility.
The building will have all private patient rooms, which maximizes family privacy and creates a better clinical environment. Importantly, the building ties into the existing diagnostic and treatment base of the existing hospital and is very, very efficient in terms of its flow, in terms of its patient care and staff flows. So very important in terms of cost considerations for the lake. The most important part of the tower probably is the patient care environment, and that is seen as this glass cube, and it sits on top of a brick frame that then ties back into the lake. So again, you see sort of the brand new cutting-edge facility, and yet it's nested in the legacy of the lake and the context of the materials that have been here historically.
Our Lady of the Lake has not undergone a major renovation like this since we actually moved to this site in 1979. So this new building will be 330,000 square feet. And inside of it we'll have a lot of things related to heart and vascular care that will rival any other organization across the United States. So they'll be able to get the latest technology, having the right environment, the right rooms, all within the Baton Rouge region. And we draw patients across the state already for a lot of our heart and vascular care, so now people even further will be able to receive that level of care within a new center that we will be constructing. We'll also have the Level 1 Trauma Center. The Level 1 Trauma Center actually will save lives within our region. Currently Baton Rouge does not have this level of sophistication, and working within our clinicians and our physicians to be able to offer that is truly a wonderful thing.
During the course of the planning here, we had more than 125 user group meetings with physicians, nurses, and management staff. We had 6 task forces. The task force dealt with IT, materials management, food service, etc. But the building really was authored by the people at the lake. We talked to patients and their families, we talked to the staff extensively, and the resultant is going to be an environment that is right for the people. So we start with the people, the programs, and the architecture embraces those ideas.
Baton Rouge is a growing community, an important community. This is literally going to save lives. The fact that our patients no longer have to go to New Orleans or Shreveport to get Level 1 trauma care will literally save lives right here in the capital city region. This means our folks won't have to leave. It will also give our LSU medical residents world-class training in every aspect of medical science. These centers have trauma surgeons, anesthesiologists, physician specialists, nurses, resuscitation equipment 24 hours a day. These Level 1 trauma centers lead the nation in advancing injury-related research, providing injury prevention services. So this is critical for our people and also as a training facility for LSU. Under this historic agreement between the state, Our Lady of the Lake, and LSU, we're creating an enterprise to share resources to allow us to compete for outstanding students, to provide high-quality care, to improve access for everybody in the region, and to increase major research opportunities right here. We've never had this kind of major public-private partnership in our state that involves faculty, clinics, training programs, as well as research, involving an institution that's already one of the largest providers of care to the indigent and the underinsured in Our Lady of the Lake. 6 major reasons why this is so important. First, the Level 1 Trauma Center. The American Trauma Society say that organized trauma care systems can reduce the risk of death by more than 50% amongst those who are seriously injured. They're an important part of our community's disaster preparedness efforts. I'd hate to tell you, I hate to have to tell you this, but as governor of this great state, I know we're going to have hurricanes again in the future. I hope we have, and I pray we have a quiet season. I hope this flooding turns out to be not as bad as people initially feared, but we know there'll be challenges. We see the tornadoes that are tearing apart the middle of our country. These trauma centers are an important part of our community's response to disasters. So the first important product of this partnership is the trauma center, but that's not all. The second, thanks to this partnership, we're developing a new urgent care center in North Baton Rouge. LSU is going to operate this new around-the-clock urgent care clinic, and this is in addition to the new clinic and diagnostic center we've already opened. They recently broke ground on this new urgent care clinic. We already have one of the highest rates of non-emergency uses of our emergency departments in the country. This new clinic will help by allowing patients to have a place to go to get their non-emergency care around the clock. Many people end up in ERs because they have nowhere else to go. 63% of the ER visits at Earl K. Long in 2008 were for non-emergency care. We rank 4th worst in the country for patients using our emergency rooms for non-emergency care. It's not good for our patients for continuity of care. It's not good for our emergency rooms. It's not good for our providers. So secondly, for the first time, we'll now have an urgent care center staffed around the clock by LSU for our residents, for our patients. Third, now we will also increase access to services for the poor. Today, currently, we have many Medicaid services. We have many Medicaid patients that can go to the lake to get these services, but we've got many patients that don't routinely have access to services like the already offered at the lake, like nuclear medicine and electrophysiology and peripheral vascular angiography and echocardiography, and there are a bunch of other services I can't pronounce. I'm not even going to bother trying to tell them to you. But the important thing is Earl K. Long's not able to offer these services today. With this partnership, our patients will be able to get access to these services just like other patients right here at Our Lady of the Lake. The fourth component will be able to improve LSU's graduate medical education. 97% of our parishes are health professional shortage areas. 25% of our practicing physicians are over the age of 65, meaning that many of them will be considering retirement in the years ahead. That means we must continue to train more doctors in Louisiana. This facility will help us to do that. We're going to relocate our GME programs. As of July of this year, Our Lady of the Lake had 51 resident slots. Upon completion of the transfer in 2013, you'll have 160 slots. Fifth, this establishes new academic and clinical buildings right here. Will now be a home to the state-of-the-art, well-capitalized facility with the best technology. The bottom line, and this gets to my sixth and final point, we know that Earl K. Long has served our community well for decades, but we also know that it wasn't sufficient to meet the challenges of the future. And so the reality is, with this groundbreaking we're offering, with this partnership, we're offering our patients access to the best health care we can provide them in the most modern facility anywhere in the state. And as a taxpayer, my sixth and final reason for being here, this groundbreaking results in a partnership between state, public, and private resources, saves the state of Louisiana over $400 million that we would have had to spend to replace a hospital, instead by partnering with the lake. We can now use those dollars for other critical needs to support other healthcare needs right here at the lake, across our region, across the entire state. So with this groundbreaking, it's more than a new building. It's about saving patients' lives, providing better quality care to our people, improving education and research opportunities, and finally saving the taxpayers of Louisiana hundreds of millions of dollars. Today is a great day, but we wouldn't have gotten here without the hard work of a lot of people. So again, I want to thank Fred and the folks at LSU. I want to thank Scott and the folks at Our Lady of the Lake. And I want to thank all the different groups that work together to make today possible. Thank you to the medical staff, because again, even though I've told you I hope not to come back with 3 young kids, 9, 7, and 4, I'm pretty sure we're going to be back pretty soon. Thank you all very much.
From the public standpoint, this is our 100 years of service within the Franciscan missionaries of Our Lady. And really, I think through the heritage of the sisters, to do what the right thing is. And that's to make sure we provide good access of good quality of care, regardless of who they are within our community. We currently do that today, and that will be continued to be extended really throughout this relationship and partnership with LSU.
What we do know is that with the continued support of state government, local government, the continued support of our colleagues who are probably the best trained that you can find anywhere, the continued addressing of the needs of the people depending on the services. We don't provide the same services throughout the state. We address the needs in the local community. We are one with our communities. We started 100 years ago like that, and I believe the next 100 years will be no different.